Assalamualaikum warahmatullahi wabarakatuh. My name is Farish Akasha bin Abdul Hadi and my student ID is BCS 2311011. Today, me and my teammates, we are going to be talking about something that is not quite known among the general public, especially of this country, which is polycystic ovary syndrome, or in short, Pcos. Before we dive into the plethora of information regarding Pcos, allow me to explain and elaborate the reason why we, as a team, decided to raise awareness about Pcos and the importance that we do so. Did you know that about 70% of women affected with Pcos remain undiagnosed worldwide? This brings us to the first and most important cause to raise awareness about this issue, which is to help women recognize symptoms early and seek medical advice. In addition, our campaign aims to reduce stigma regarding Pcos and promote understanding by educating the public, including men. Last but not least, Pcos is linked to serious health issues like diabetes, cardiovascular disease, and mental health challenges. Ergo, increased awareness helps in preventing and managing these risks.
Hi, my name is Adam Mukris Abdurrahman and my ID number is BCS 2311-036. Now, I would like to talk about what are the common causes of Pcos and how do people usually get it. Pcos, or polycystic ovary syndrome, is a common hormonal disorder that affects individuals with ovaries, which in this context women, usually during their reproductive years. It is characterized by a range of symptoms including irregular menstrual cycles, high level of androgens, and the presence of multiple cysts on the ovaries. Pcos can lead to various health issues such as infertility, metabolic problems, and increased risk of diabetes. What are the common causes of Pcos? While the exact cause of Pcos is unclear, certain factors may increase of risk developing it. I'm going to give you 4 examples. The first example is genetic predisposition. Pcos can run in families. The second example is insulin resistant. Many individuals with Pcos have insulin resistant, which means their body struggle to use insulin effectively, leading to higher insulin level. This can cause the ovaries to produce more androgens, which can worsen the symptoms. The third example is hormonal imbalance. An imbalance in reproductive hormones can cause issues with ovulation, leading to irregular periods and the development of cysts on the ovaries. And the last example is lifestyle factors. Obesity, poor diet, and the lack of physical activity can exacerbate insulin resistance and other symptoms of Pcos. How do people get Pcos? Well, Pcos is not something that someone gets in the same way as an infection, but it's believed to develop from a combination of genetic and environmental factors. A family history of Pcos or related condition like type 2 diabetes can increase the likelihood of developing the disorder. Lifestyle factors such as poor diet, obesity, and lack of exercise can worsen symptoms but are not direct causes.
Assalamualaikum, my name is Asmahani binti Helmi. My ID number is BCS 2311-04. I'm going to talk about causes of Pcos, symptoms, and when to seek treatment. The first causes is hormonal changes. Pcos is often caused by high levels of male hormones, which can prevent regular ovulation. This means the ovaries don't release eggs as they should. And the second one is insulin issues. Many individuals with Pcos have difficulty using insulin effectively. This can lead to higher insulin levels, which may increase the production of male hormones. And the third one is family history. Pcos can run in families. So, if someone in your family has it, you may be at a higher risk of developing the condition. So, for the symptoms of Pcos, the first one is irregular periods. People with Pcos may experience irregular menstrual cycles, meaning their periods can be very late miss or last longer than usual. And the second one is extra hair growth and skin issues. Many individuals develop unwanted hair on their face and body. They may also have acne and thinning hair on their scalp. And the third one is ovaries with cysts. Pcos often leads to enlarged ovaries with many small cysts inside, which can be seen during an ultrasound examination. So, when we have to seek treatment for irregular menstrual cycles? The first one, if your periods are consistently irregular missings or very long, it is a good idea to talk to a doctor. And the second one is excess hair and skin problems. If you notice significant unwanted hair growth, severe acne or hair loss, the symptoms should be discussed with a healthcare provider. And the last one is difficulty getting pregnant. If you are trying to have a baby and find it hard to conceive, it is important to seek medical advice to understand of your options.
Assalamualaikum. My name is Nurul Alia binti Ahmad Fazil and my student number is BCS 2311030. I'm going to explain about the treatment of Pcos and ways to prevent from getting Pcos. Treatment for Pcos depend on your systems, health history and whether you want to get pregnant. Your doctor may suggest medications, lifestyle changes or a combination of both. If pregnancy is not your goal, hormonal birth control options like pill, patches or IUDs can help regulate your periods, reduce acne and manage excess hair growth. Metformin can help balance insulin and improve your cycle. Some medications block male hormones to control acne and unwanted hair growth. Additionally, healthy eating and maintaining a good weight can improve insulin levels and overall health. If you are trying to get pregnant, the focus is on helping you ovulate. Medications like clomiphene, letrozole or hormone injection can trigger ovulation. Surgery is rarely used but can be an option in some cases. If medications do not work, IVF, where an egg is fertilized in a lab and placed in your uterus, is another option. Though there's no proven way to prevent Pcos, you can manage its symptoms eating nutritious food, exercising regularly, and maintaining a healthy weight for your body can make a big difference in reducing the effect of Pcos.
My name is Nur Shakirah binti Rozani and my ID student is BCS 2311035. I'm going to talk about impact and complication of Pcos. Pcos can lead to several health problems over time. One of the main issue is infertility, as the condition can make it hard to get pregnant. Women with Pcos also have a higher risk of developing type 2 of diabetes, because their body have trouble using insulin. Pcos can also increase the chance of heart disease because it's linked to the blood pressure, high cholesterol and weight gain. In addition, if a woman does not have regular period, it can cause the lining uterus to become too thick, which may increase the height of uterine cancer. Pcos can also affect mental health, making women feel anxious and depressed due to symptoms like weight gain and unwanted hair growth. Some women with Pcos, especially those who are overweight, may have a sleep problem like sleep apnea.